Okay, y'all, last one. So I wanted to show you some of the wound care products. I know it's on my slides. It's in my PowerPoint that you're going to see next week. But here's some of the products firsthand, and then I'm going to pass them around. Okay, the first thing that is your first line of defense, y'all, this is EPC. This is a specific brand, but it really is just zinc oxide. So think about Desitin diaper rash cream, but it doesn't smell like a baby, okay? This is great for patients who are incontinent, for patients who are having diarrhea, somebody that just has a lot of moisture and just needs a layer of skin protection. So this is good stuff. You can slather it on, put it in creases, folds, whatever you need to do where the skin needs a little extra protection, okay, from moisture-associated skin damage. So that's zinc oxide. We call it EPC. You can mix it with regular lotion if it's too thick, and it spreads on a lot easier. So this is good stuff. And then we talked about dressings for shallow wounds. One of the ones we talked about was a hydrocolloid. Some people call it a Duoderm. This is good for like a little friction wound. See how thin it is? A little friction wound on somebody's backside. It melts to the skin. It helps slide over that wound, and they're not pulling on that skin. But you can also use this on heels or elbows, or if you just have a little wound on the arm and you just want to cover it. That's not draining a lot. It's not going to absorb a lot, but it's a good little dressing for a shallow wound. Then we have Xeroform or Vaseline gauze. This is great, y'all, for skin tears. When you have a patient that's older or has really thin skin and their skin tears, the last thing you want to do is put any kind of adhesive on that. So it's great for that as a Xeroform or a Vaseline or petrolatum gauze, and then just wrap it with some gauze, tape gauze to gauze, no tape on skin, and you can change that out like every other day. And it's nice, it's moist, it's got a little antibacterial coverage, and it'll help that skin tear heal up really fast. And then I showed you the foam with wings. This is a foam that you can use anywhere. You can use it on a leg, you can use it on an arm, you can use it on a bottom. It's absorptive and it cushions. So if you have a little, like a big skin tear on the leg and you don't want to do the Vaseline gauze, this would be appropriate for that too. And this does absorb. So if you got something that's straining a little bit, they bump their leg or something like that, this will absorb a little bit of drainage. All right, for the deeper wounds, y'all, we have a couple of things. Anytime you have a wound that is packable, it really needs to be packed. What we say is you want to fill dead space. And by dead, I mean empty space. Bacteria love empty space. So you don't want to leave empty space open. Always think, I need to fill it. You don't want to stuff it. It's not a Thanksgiving turkey. We want to just lightly fill it, right? So a couple of things. This is Aquacel AG, one of my favorites. It looks like gauze, but it actually has silver woven through it. Silver is very antimicrobial. We've been using this for a long time, and I mean good metallic silver. It kills bacteria, one of the most basic things in the world. But this dressing is awesome because the silver kills bacteria and it's made to pull a lot of moisture. You can cut it in a strip, you can fold it, you can stack it, you can lay it however you want. It comes in a lot of different sizes. This is the most basic, but it will absorb a lot of fluid too. Something else you can fill a space with if you don't need antibacterial coverage is an alginate. This is called Algicite. This is just one brand. It's actually made from seaweed or algae, and it is made to absorb a lot of drainage. So if you have something that's just draining, and wound care hasn't come, you can grab an alginate, put it on there. The other thing this can help with, if you have a wound that's just oozing blood, not a wound that's pumping blood, but a wound that's oozing, this will actually help stop it. So alginate is a really good filler. I wouldn't pack a wound with it because you can lose a piece in there. So not a super deep wound, but it's good for something that's oozing a lot. Something you can pack in a deep wound is Acticoat. As you can see, this also has silver and it will stain. So if you take this off a wound and it's black, it's from the silver. You can cut this in strips. You can actually do like a coil and do a really long strip and pack this in like a deep wound or an IND or something like that, an abscess. This pulls out a lot of drainage. It can stay for 3 days. Note it says 3. There is one called Acticoat 7 that can stay for 7 days, which is really cool. And it's kind of an open weave, so it moves a lot of fluid through it to whatever is on top of it. With any of those dressings I just mentioned, you would want to apply some gauze or an ABD pad on top and tape it, because they're going to move the fluid to whatever is covering it. So you want an absorptive dressing on top, whether it's a foam like I showed you, an ABD pad, and then make sure it's taped and secured on all 4 sides, okay? Then you have your gauze, and there's lots of different kinds. You can use these to pack with. This is good. You can wrap this around a small body part, or you can pack it in a wound. Always leave out a tail so you can remove it in one piece. So you would never pack a deep wound with like one single 4x4 gauze. You're going to put like a long piece in there that you can pull back out. If it's a really small area, you can use a packing strip. I would never touch it with my bare hands except this one's expired. But you can cut off a piece of this packing strip and pack it into a really deep, narrow passage. That's what that's great for, okay? And then these are your gauze that you can use to pack if you have a big cavernous sacral wound, or if you need to wrap something around somebody's extremity or leg or heel. These are great for that. And then finally, I showed you this on the PowerPoint, but here is a wound vac dressing. This is the actual foam. It's called Granufoam. It's actually very porous. You would cut this to fit in your wound. You would obviously not shove this in, although I have seen some surgeons try. You would cut this to fit in your patient's wound, cover it with what looks like Tegaderm or Opsite. It's called thin film, and then hook it up with a tube to the machine, create some suction, and usually these heal really, really well. And that's appropriate for almost any kind of wound that needs kind of a rapid granulation and healing. So that is it. I'm going to pass around some stuff that y'all can see and get your hands on, and then again, we'll talk about any questions you have.